Next, we see in A the head of the condyle bone, B is the articular eminence, C is the mandibular fossa made of compact bone, D is the articular disc region, E is the superior synovial cavity, F the inferior synovial cavity, G is the lateral pterygoid muscle fibers, H is the superior retrodiscal lamina, and I is the inferior retrodiscal lamina, or the retropad of the disc. A magnified view of the interarticular disc made up of fibers and fibroblast cells with chondrocyte cells. In the adults, it is more like chondrocyte-like cells, while in children we have more flattened fibroblast-like cells. The disc is also made of proteoglycans, 5% of the volume, which absorb the water and resist the compressive loading. In white is the cavity, synovial cavity, and beneath is the lower compartment, which is divided into an upper fibrous layer or fibrous covering, also made up of collagen fibers mainly, and fibroblasts and some elastin fibers. We see the transition zone between the very superior layer here, very superficial layer, the laminal splendid, which is very smooth surface, and the which is made of parallel collagen fibers, and the deeper layer of perpendicular collagen fibers. You see there is a transition zone in between. So irregular fibers are deeper, which come in contact with the dark. Here you see the proliferative zone of cells, darker, and the cartilage, the calcified cartilage layer. The same view of the lower compartment, articular surface, showing underneath the compact and cancellous bone. Again, a more magnified view of the parallel collagen fibers in the surface of the fibrous layer, and the perpendicular fibers deeper in the layer. The cells found there are the fibroblasts and fibrocytes. Underneath is the cell-rich zone and the fibrocartilaginous zone with more cartilage-like cells.